Hi ladies and gentlemen, this is Dr. Mora. I hope that all of you are doing great today. Wanted to show you an x-ray of an elbow. This is an elbow, the side view of an elbow in a high-level mixed martial artist who's been having catching and locking of their elbow. Very common condition that happens in mixed martial artists, and what they develop is an early arthrosis or early degenerative changes. What are spur formation or overgrowth of spurs, loose bodies that are floating in the joint, irregular joint surface. This patient's not too bad at all over here. And little spurs in the back, but what does it really all equate to in the end? What it really means is that the patient ends up having catching, locking, swelling of the elbow. It just happens, especially with increased activity, to the point that they start to lose their extension. So the patient is not able to train at the highest level. The workup includes x-rays. This is the side view or the lateral view. This is a AP view, which stands for anterior posterior view, and if you look right over here you can see a loose body. So x-rays are very important in these cases, and so I'll show you a CT scan here in a second. Here's a CT scan of an elbow in the front, loose body in the back, overgrowth of the coronoid over here, overgrowth of the olecranon fossa, and even an overgrowth of the coronoid fossa. So these findings will lead to loss of motion, pain with motion, and catching and locking because of the loose body. So CT scan is a go-to test for my fighters who are having catching and locking of their elbow. That's a take-home message here for the evaluation of cauliflower elbow. Treating the cauliflower elbow mixed martial arts requires an expertise in elbow arthroscopy. This is what I do for the treating of cauliflower elbow. Number one is remove all the loose bodies. Here you can just see one, but there's multiple in here. We create the hourglass. I take down some of this anterior coronoid that's impinging on the hourglass area. Take down a small area of the olecranon tip. Recontour the olecranon fossa. Remove the loose bodies. If you're a high-level mixed martial artist who's suffering from catching, locking of their elbow, you're getting to the point that you can't train, can't do the things that you love to do, make sure you see someone who has experience treating this condition. Get x-rays, get a CT scan. CT scan especially matters, and if you end up having arthroscopy, please know that the result in most cases is excellent. You'll be back hitting a bag in no time. Please share it with your friends who have catching, locking their elbow, and as always, friends, wherever it is that you may be, thank you so much for having an interest in what I do. Be safe and be strong. Dr. Mora, over and out.